If you've been avoiding egg yolks because of cholesterol, it's time to look at what the actual research says. For decades, seniors were told to skip the yolk and stick to egg whites. That advice came from a genuine, well-meaning place, but it was based on outdated science. I want to walk you through what changed and why so many people are still following advice that's decades behind the evidence. Here's where the fear started. Back in the 1960s and 70s, researchers noticed that blood cholesterol was linked to heart disease. Eggs are high in dietary cholesterol, so eggs got blamed. The advice became simple. Cut the cholesterol you eat, and you'll lower the cholesterol in your blood. It sounded logical, but the body doesn't actually work that way for most people. Your liver produces most of the cholesterol in your bloodstream, not your diet. When you eat more cholesterol, your liver typically produces less to compensate. When you eat less, your liver produces more. For the majority of people, dietary cholesterol has a fairly small effect on blood cholesterol levels. This isn't a fringe opinion anymore. Major health organizations have walked back the old guidance. The 2015 to 2020 dietary guidelines for Americans removed the specific daily limit on dietary cholesterol that had existed for decades. The American Heart Association has also shifted its focus toward overall dietary patterns rather than treating egg yolks as an isolated danger. Large studies have backed this shift. A 2020 study published in the Journal of the American College of Cardiology followed over 170,000 people and found that moderate egg consumption was not associated with an increased risk of heart disease or stroke in most populations studied. Other large cohort studies have found similar results, up to about 1 egg a day showing no clear link to increase cardiovascular risk for most healthy adults. So why does this matter more after 60? Because seniors are often the group most likely to still be following the old, outdated advice. And that means they may be needlessly avoiding one of the most nutrient-dense, affordable foods available. The yolk is where almost all the nutrition is. Egg whites are mostly just protein. The yolk contains choline, which supports brain and nerve function, and which most older adults don't get enough of. It contains vitamin D, which supports bone strength and immune health, and which becomes harder to get enough of with age. It contains lutein and zeaxanthin, two nutrients specifically linked to protecting eye health and reducing the risk of age-related macular degeneration. It also contains vitamin B12, which becomes harder for the body to absorb from food as we get older. Skipping the yolk means skipping nearly all of these benefits while keeping only the protein. Now, this doesn't mean cholesterol never matters. For a smaller subset of people, sometimes called hyperresponders, dietary cholesterol does raise blood cholesterol more significantly. People with certain genetic conditions or those who already have very high LDL cholesterol should still talk with their doctor about how many eggs make sense for them individually. This also isn't a reason to eat eggs however you like without any thought. What actually matters more for heart health is how the eggs are prepared and what they're eaten with. An egg fried in butter alongside bacon and white toast is a very different meal than a boiled egg alongside vegetables. The company eggs keep on your plate matters more than the eggs themselves. So, what's a reasonable takeaway? For most healthy older adults, a whole egg, yolk included, eaten in moderation is not the danger it was once made out to be. 1 egg a day, or even more for many people, fits comfortably within a heart-healthy diet, according to the current evidence. The bigger nutritional mistake isn't eating the yolk. It's avoiding it and missing out on nutrients that become more important, not less, as we age. If you have existing heart disease, familial high cholesterol, or diabetes, this is exactly the kind of thing worth a quick conversation with your doctor, since individual guidance can differ from general population research. But for most people over 60 who've simply been avoiding yolks out of old habit or old advice, it may be worth reconsidering. The science changed. It might be time your breakfast did too.